Well, I'm a plastic surgeon. The word plastic comes from the Greek word plastikos, which means to mold. So our specialty is one where we do a lot of reconstructive type of work. So it crosses many different anatomical barriers. There's literally no place on the human body other than in the intra-abdominal or the thoracic cavities that we won't operate. So we go from top to bottom, and each one of us has different areas of specialty and expertise in that. So my special areas would be pediatric plastic surgery and then peripheral nerve surgery. So peripheral nerve surgery, I do that with Dr. Moorhart, and it basically, anything that's outside of the spinal cord, any of the nerves that are outside of that get damaged, we reconstruct. That's the thing about plastics, there is no real typical. I have a mix of clinical and operative practice as well as administration. So from a clinical standpoint, I'll see patients a lot of times. I have a half day a week where I'll do lumps and bumps, so that's various small hand problems, carpal tunnel, trigger digits, Dupuytren's contracture, or I'll take off moles or skin cancers and reconstruct them. I do a lot of interdisciplinary clinics where I'll have like a cleft lip and palate clinic where we have a plastic surgeon, there's an ENT surgeon, there's a orthodontists, social workers, pediatricians, speech language pathologists, and oral surgeons all working together. Then I'll do some of my elective clinics for some elective practice. And then I have trauma clinics during the week as well. And then I have a variety of ORs. So I'll always have a pediatric OR. Sometimes I have an adult elective OR in a week. And then sometimes I have my peripheral nerve clinics or operations as well. I liked school first and foremost, so I was reasonable at it, like a lot of people in high school. And I started looking around and thinking of the different types of jobs I could do. Medicine always seemed very interesting. I think the biggest misconception about plastics is that it's cosmetic surgery. And it's in Canada, certainly that's not the case. Probably less than 10% of what plastic surgeons do would be considered cosmetic care. I think one of the myths we face in plastic surgery is that people think that you won't scar, right?
Yeah.
If you make a cut all the way through your skin, you will scar. Plastic surgeons are good at hiding those scars in areas that are difficult to see, but if you have a full thickness cut, you're going to have a scar. The other myth that I face all the time, because I do pediatrics, is that people always believe that kids scar better. And in fact, they don't. They get worse scars. The adults. The way to make sense of that, wrap your head around that, is that kids heal better. The way that the human body heals is by putting down scar tissue. That's our glue. That's how we hold ourselves together. So if you get a cut or an injury, you put down scar tissue. When you're younger and healthier and can heal better, you put down more of it, more rapidly. The best scars we get are in elderly people who don't heal as rapidly. We're not looking for the person with the highest marks, the best researcher. We're looking for somebody with the highest emotional IQ. There's red flags that go up every once in a while. It doesn't mean that it's not, you can't get in, but if the person who, never did anything else but schoolwork, never traveled, never did team sports, never played any musical instruments, doesn't have any other experience, they don't maybe have that concept of team and that ability to socialize that you need. You absolutely need it to be a physician, because it's not just socializing, going and seeing how your patient is in the morning. You need to be able to connect with them and understand what their problem is, because they can't explain it a lot of times. And although they may come in with an injury that you look at and say, this is the problem, that's not their biggest concern, and you have to be able to pick out what their concern is so you can deal with it.